Greetings, my name is Moytrayee Guha, and my leadership project is titled Leadership in Action, Strengthening Health System Resilience and Performance. A brief introduction, I'm the Program Director at the Center for Health System Sustainability at Brown University and a Senior Health Specialist at the World Bank. I'm also pursuing my DRPH at Johns Hopkins. My interests are in health system strengthening, implementation science, health emergency preparedness and response, MNCH, and capacity building. I'm also interested in really utilizing my leadership management and strategy development skills to translate evidence to practice and policy. The frequency of health emergencies is increasing, with many countries facing multiple crises simultaneously. This includes pandemics, climate disasters, conflicts, and political crises. As we all know, diseases don't respect boundaries, and we've seen that an outbreak in one country can spread around the world in just 24 to 36 hours. So a health threat anywhere is a health threat everywhere. Health systems are facing similar challenges, such as aging populations, increased chronic disease and multimorbidity, climate change, and research shows that health systems are dangerously underprepared for this new reality, making resilience a necessity, not an option. Over the years, my work has focused on really understanding health system resilience. How do you strengthen and operationalize resilience to health emergencies in developing countries? Applying health system performance assessment frameworks and tools to inform policymaking and strengthen resilience, and integrating a women's leadership lens to existing resilience frameworks and capacity building efforts. In 2023, I helped establish the Center for Health System Sustainability at Brown University. This center focuses on advancing comparative health systems research. It's a hub for cross-country learning and interdisciplinary collaboration, and really understanding the factors that contribute to health system resilience, sustainability, and high performance, and what it takes to prepare against future shocks such as epidemics, climate change, and economic crises, and also working with policymakers to make data-informed decisions. My work is focused on the WHO's Health System Performance Assessment Framework, which is a framework that offers policymakers a conceptual tool for comprehensive assessment of health system performance. In order to build resilient health systems, we need to understand and increase health system performance. This is a framework of the HSPA framework. I won't go into too much details, but it essentially shows the health system within the socioeconomic and political context of the country. The functions are governance, resource generation, service delivery, and financing, and how they relate to a health system's objectives and final goals, such as people-centeredness, health improvement, and financial protection. We worked with experts across the field in academia, government, multilateral agencies, and INGOs to publish a handbook for health system resilience for policymakers to really provide a summary of the existing evidence and some actionable recommendations based on real-world case studies for strengthening resilience in health systems in varying contexts. And there's a QR code there if you're interested to read more about this. And what I've been more interested in as part of my leadership project is really dive in deeper into the function of governance. Effective governance and leadership are essential for building resilient, integrated, and people-centered health systems, but they're poorly understood and overlooked in resilience efforts, especially its connection to gender dynamics. Evidence shows that women leadership enhances health system resilience by fostering more inclusive and equitable decision-making processes. Women are more likely to advocate for data-driven, patient-centered policies and integrate diverse perspectives into decision-makings, as well as promote transparency and accountability in health governance. Now, switching gears to the work I do at the World Bank, I've supported various multi-sectoral capacity building efforts to strengthen health system resilience and health emergency preparedness and response. We've worked with ministries of health, finance, agriculture, disaster planning to really start this multi-sectoral dialogue around how to operationalize resilience of health systems. We've developed frameworks and training programs that identify core capacities and enablers that enhance resilience functions and provide recommendations to governments on how to implement these recommendations. If you're interested, these reports are publicly available on the World Bank portal. And now going back to my leadership journey, so in the space of health emergencies and resilience, it has become very clear to me that the technical competence is not sufficient. In order to really operationalize resilience and be a strong leader in the space, you absolutely need the leadership management capabilities, such as systems thinking and change management, understanding governance and accountability, data-driven decision-making, and quality improvement. So I've really focused and a lot of time in leadership development over the past 2 years through the leadership journey, as well as other efforts through the World Bank and Hopkins that I'm a part of, and conducted a couple of senior leader interviews. And I just wanted to give you a taste of some emerging themes and key takeaways. This is really just the tip of the iceberg, but some that really resonated with me is really investing in relationship building and networking for mutual growth, mentorship, and leadership opportunities, developing others and the next generation of women leaders, as well as partnering with male allies are important to drive systemic change. Mentors, coaches, and champions matter. Each play a unique role in career growth. And really thinking about creating a personal board of directors who will support you in navigating challenges, complex decisions, and leadership transitions. And today, more than ever, really developing resilience and adaptability. Change is an inevitable part of leadership, and viewing challenges as opportunities for growth and learning. And leadership is not a solo act. It takes a village in the work we do. Building a multidisciplinary team, strong partnerships, and developing others is extremely important to driving long-term meaningful impact. One of the leaders mentioned these 4 Ps of leadership that really stuck with me: passion, patience, perseverance, and partnership. Identify your why, understand your purpose, and use it as a guiding principle throughout your career. Don't underestimate importance of soft skills and emotional intelligence, which is something women excel in. And really making sure that you're using this, but also being authentic and calibrating it to the context, being very aware of who your audience is, taking risks and embracing failure, using your voice and advocating for yourself and the communities you represent, but don't feel fear of failure. It is an opportunity for learning, growth, and leadership development. And finally, commit to lifelong learning and capacity building. Thank you for your time, and a huge thanks to the WomenLift Health community for this incredible opportunity. Thank you.